I am Ashwini Murthy, intensivist and head of medical services at Avanta Healthcare Private Limited. I'll be saying a few things briefly about neurorehabilitation. Neurorehabilitation is generally a program designed for people with diseases, injury, or disorders of the nervous system. It improves functioning, reduces symptoms, and it improves the overall well-being of the patient. Now, what are the conditions that would require neurorehabilitation? It can be injuries, infections, degenerative diseases, structural defects, tumors, or other disorders in circulation for the nervous system. So, what could these be? What conditions can require such rehabilitation? It can be vascular conditions like an ischemic stroke or a hemorrhagic stroke or TIA, transient ischemic attack. Now, infections of the nervous system which may require a long-term care or rehabilitation would be meningitis, encephalitis, polio, or brain abscess. The next major category that would require neuro rehab would be trauma. Any spinal cord injury, traumatic brain injury, such things which can leave a long-term defect or disability will require rehabilitation. There are certain structural conditions like Bell's palsy, carpal tunnel syndrome, spinal cord tumors, muscular dystrophy, Huntington's chorea. Again, all these are long-term disabilities which will require neurorehabilitation. And certain functional conditions like headache, that is long-standing unremitting headaches, seizure disorders, neuralgial pains, such conditions will require rehab. Degenerative diseases like Parkinson's disease, Alzheimer's disease, ALS, such things also require neurorehabilitation. So, what does neurorehabilitation actually entail? What are the goals of the program? It is usually designed to meet individual needs. It includes help with activities of daily living like eating, bathing, brushing, toilet, such everyday activities. They will be given training and support to recover to the state of optimal functioning. That depends on the individual patient and the condition for which they are being treated. Then we have speech therapy and management of stress and anxiety and depression, which comes as a part of this such long-term illnesses. Bladder and bowel training, because many of the neurological conditions, particularly spinal cord injuries, will make the person lose their control over bladder and bowel. So, neuro rehab is programmed to train them to regain their control over bladder and bowel activities. And then a set of activities which will help them improve their mobility, muscular control, gait, and balance. Exercise programs to improve movement or to decrease weaknesses caused by lack of activity or usage, and also in the management of spasticity and pain. It will also help to maintain the range of movement. To improve cognitive impairments, to help in assistive devices. So a lot of these patients will not be able to manage on their own, so they'll require assistive devices like a walker or a wheelchair, and people need to be trained how to use these things. All these things come under the Neuro Rehabilitation program. And the most important part is education and counseling, which is not only for the patient but also for the caregivers and the family. So all these things make up the whole program of Neuro Rehabilitation, for which there are specialized centers like Avanta Healthcare and many centers like that who provide specific targeted customized programs to help patients with neurological disabilities. Thank you.
Healing hands, care of hearts.